and welcome all to Dr. Luke on Call, the channel where we share accurate medical information to all communities. I'm Dr. Schalk, and I truly believe that it is through lack of knowledge that people perish. Welcome to all the new viewers, and a special welcome to the people that commented and asked questions on the previous video. Anki in Canada, Caitlin in Dubai, hello Caitlin. To the Ethiopian community, salam, Tena Yisteling. Sawona Umama Marunzela, Ujainam Klajamam. And if you would like a special greeting, I really love languages. So if you want me to try out your language, leave a comment down below, tell me what your language is, and I'll greet you in the next video. Okay, let's jump right into it. Today, we are discussing oxygen. And why oxygen? The virus that we now all know is really challenging healthcare practitioners and healthcare workers with patients that develop very low oxygen levels. Remember, we all know that 85% of people, more or less, will be well. They'll be at home, they'll have some symptoms, they will be ill, but they can look after themselves, do all the right things that we've spoken about, and they will recover. But there's definitely a percentage of people, 10 to 15%, that might need hospital admission. Some might need high level oxygen flow. Some might even need high care or ICU admission, and as a last resort, intubation and ventilation on a machine. However, there's a really important thing that we can do, and that is to check our own oxygen. If you get infected with the virus and you go past day 5 or day 7 and you're not feeling well, or you start developing your dry cough and the dry cough doesn't get better, or you're worried to sleep at night, you're worried that you won't be able to breathe properly, a pulse oximeter is a very, very good thing to have available. I'm going to do a little bit of a review on a pulse oximeter, show you exactly how it works and what amazing piece of equipment it is that we now have. Remember, previously we had to take blood to look at your oxygen. Now we can use a little device like this called a pulse oximeter that we can put on your finger, and with a light sensor it is able to pick up what the oxygen levels are in the capillaries in your blood vessels in your finger. Let's have a look at a little demonstration video. Okay, so here we've got our pulse oximeter. Opening the box for you. Very nice packaging. It's got instruction manual on the inside in English, so very easy to adjust. You can adjust the display settings, you can adjust the sound, you can adjust the alarm settings. If you look at the device itself, also comes with a cord that you can attach to it. Through that little opening there, the device works with 2 AAA batteries. Really easy to replace. Just make sure you put them in the right way around. And then switching it on, there's the button to switch it on. Just takes a few seconds to boot up. Doesn't take very long. And then as it indicates to you, finger out, so you've got to open it up. Okay, you've got to put your finger in right there. And what the device does, it's got a light source down the bottom and a receiver on the other side. So the light source goes through your finger, through the tissue, and the absorption of light, there's actually 2 frequencies that it has. The absorption of light and the difference between the two is a very interesting mathematical calculation that they have, and that gives you the estimated oxygen flow, and it's actually very accurate. You'll see in another clip that I've tested it with a device that they use in hospital theaters, and it varies by maybe 1%. What's very handy is that it has different view settings. If you double click, you can enlarge the view. You can just flip it around so that someone else can see what's happening. Or you can flip it around for yourself. Oxygen 99%, pulse rate, and then down the bottom you've got perfusion index. Now that's really important because it varies from 0.2 to 20%. And it's got to be above 1% to be accurate. If it's less than 1%, you've got to adjust the device, change it around a little bit, maybe change the finger. Also, if your finger is very cold, it's not going to be accurate. But all in all, a really good device, very cost effective, and very important device that you can use to tell you what your body is like, what your lungs are like, and if your oxygen is affected when you have the viral infection. So as you can see, technology has really brought incredible devices into our homes. If you can't get hold of a pulse oximeter, or if you can't afford one, you can go to your local clinic, your nurse care practitioner, or your local GP, and they can check your oxygen levels for you. But most of the time they are available online. You can order them and they will deliver them at your home. It's also a device that you can use for multiple people that get sick. Just make sure you clean the device before you change it and use it on another person. People might ask, but are they really accurate? Is it really something that we can trust? So what I did, I took two of these devices, an old one that I've had for a while and a brand new one that I'm testing at the moment, to a hospital theatre where they use actual anesthetic equipment to monitor pulse rates. And I put the devices on the fingers of a healthcare worker, and you can see in the next clip that they are very accurate. Basically 1 or 2% or 1 or 2 beats difference in the three devices. Have a look. Okay, so what are the levels that we're looking at? What are the important levels? Normal level is above 97, let's say 98 or 99%. If your levels go a little bit lower, it might be because your fingers are cold, it might be because it's not picking up properly. But if the levels go below 93%, it will need some attention. Also for the pulse rate, a pulse rate that goes above 100, especially above 120 beats per minute, is not a good pulse rate. And there you know that the body is trying to compensate for the low oxygen by increasing the heart rate. So the heart rate compensates to give you more oxygen in your brain and in the rest of your body. So when you use a pulse oximeter and the oxygen levels fall below 93%, especially below 90%, you need to get some help. Don't wait till you feel bad. Don't wait if you struggle with breathing. If you've got oxygen levels, it's a very good indicator, and it really helps the medical workers and the healthcare providers to know how to give appropriate care. You might just have to go into hospital and get 2 or 3 days of high flow oxygen and you are well. But if you wait too long, it might need more urgent care and you could have prevented that. Remember, the patients that need admission are a small percentage. Generally, the higher risk patients are diabetics, hypertensive patients, patients that have obesity, patients that have got a very strong smoking history, and also immune compromised patients like HIV or other immune compromised situations where your immune system is not able to respond the way it should normally respond. So to summarize, in a pulse oximeter, we've got a very handy device that is available to the public that you can use to get an idea how you are doing. It's also information that you can give to your doctor or your clinic nurse practitioner so that they can know how you are doing. Then now is the time for the Q&A session. The question of the day, and leave the answer in the comments if you remember. What is the crucial cutoff oxygen percentage that you should watch out for? Below what percentage should you look for help? Leave your answer in the comments and let's see if you actually listened to those levels, because they're important, and if you know what to look out for, then you know when to get help. Remember, these are difficult times we're going through. They are really challenging to a lot of people, but we will get through this. We will get through this stronger. So keep on doing the right thing, keep your social distance, wear your masks in public to not infect others, make sure you wash your hands, and above all, stay healthy.